So in this video, I want to talk about issues in SSI. This is a complicated program. It has a lot of pressure on it. It is also a welfare program, and so the debate about welfare is, and there's a deep concern about people somehow manipulating this program and actually not being disabled. So the first one is the issue that I talked about in the last video between children and their caretakers. Are children being qualified for disabilities so the family can get this benefit? And so one of the reasons the benefit is so low is to create a disincentive for people to do this. So substance abuse does make people lose capacity. But we decided, again in the Reagan administration, that substance abuse was a choice that people made. And so unless there is another medical diagnosis, simply advanced substance abuse does not allow you to qualify for disability. If, on the other hand, you have some kind of a mental illness that's related to it, or a physical disability like cirrhosis of the liver, then you can be qualified. So there's efforts by disabled people to re-enter the workforce. You can understand that if you're making $750 a month, you would be looking for ways to overcome that, to get back in and to be able to raise your income and make yourself more stable and to remove some of the stigma that's related. SSI has been removed from non-citizens except in very rare cases, and this had to do with the concern about immigrants bringing their disabled relatives to the country or their aged relatives. So for people that are homeless, it is not uncommon for them to have either a physical or a mental disability. And so often qualifying people for SSI is a way to allow them to move into some more stable living arrangement and cease to be homeless. So one of the groups of homelessness are these people, are folks who've sort of fallen through the system and have disability. So there is a move to return SSI to the states. It was a state program. It was President Nixon that federalized it and made it a national program. And so there is a move in Congress on some people's parts to return this to the state with a block grant, the federal government providing some money, but the administration to the state. But the final and most important question is who's disabled? And how do we measure disability? And you'll remember in an earlier video, I would say that those people that no one will hire are disabled. But typically in SSDI and SSI, we use a medical definition. And so there has to be a medical measure of your disability to qualify. And so if you have some kind of complex mix of a mild mental illness and some learning disability and some history of trauma and emotional, that you will be skipped by this system and not be given disability, although you may not ever really be able to functionally work. And so this boundary between who can work and who can't work, you'll remember, is rooted in the English Poor Law, is an argument that's been going on forever in social welfare. We talked about it in the last module around poor families with children, and in this module we're talking about it around the issue of disability. So SSI is a program that's really important in America. There are certain people that we definitely are aware need support. And then there are other places where we have quite a bit of controversy about exactly who should get this benefit.